So, feline infectious peritonitis, also known as FIP, is a leading cause of death in kittens and young cats in America, especially at shelters where there's lots of them. According to the American Veterinary Medical Association, or the AVMA, approximately 30% of U.S. households have at least one cat. That equates to about 36.1 million households in America that have at least one cat, and most of those cats come from shelters. My household is one of those that owns several cats, and while we lived in Arizona, I would foster kittens, and one of those kittens that we fostered, Jem, ended up developing FIP after we had a coronavirus outbreak at the shelter, and he spent a night in the ICU. He was able to receive excellent care, and we were able to give him a good life for longer than what was expected for that disease. This is why this topic is so important to me, is because of him and the fact that it is always fatal. The three main points that we will discuss is what exactly FIP is, who is susceptible to it, and how it is currently treated and what research is being done for it currently. So, let's begin by identifying what actually is FIP. Feline infectious peritonitis is a viral disease occurring in cats that is caused by a specific mutation to the coronavirus. Most strains of the coronavirus are avirulent, which means it doesn't cause a disease, they just are carriers of it. It is commonly known as the kitty cold, and it is very prevalent. Lots of cats end up getting it, and generally it's harmless. Only about 5 to 10% of those infected with coronavirus undergo the mutation that causes FIP. What causes this mutation is generally caused by stress factors, and like in the case of Jem, when he was put in ICU for a night, that would be the stress factor that most likely caused his mutation. The cat's own body is what helps the viral infection spread. Antibodies are used to infect healthy white blood cells in the cat with the virus, and then those white blood cells spread throughout the body and infect all of the organs, such as the kidney, brain, and everything in the cat's abdomen. The way that FIP develops as an immune-mediated disease is unique, and it's unlike any disease found in animals or humans, which is why it's so hard to cure and it's hard to study. There are two forms of FIP. The first is an effusive wet form, which progresses rapidly and is typically seen first. It is characterized by fluid gathering in the abdomen, which gives the cats a pot-bellied appearance. This causes breathing difficulties, as well as the virus is essentially trying to liquefy the organs inside the cat. The second is a non-effusive dry form, which the symptoms aren't noticed right away just because cats are generally able to mask discomfort. But these symptoms include weight loss, loss of appetite, depression, and a high fever that is not always able to respond to antibiotics. So now that we've talked about what FIP is, we should discuss who's susceptible to it. So that would be cats that carry the coronavirus, whether they are just carriers or they actually have the disease. They're the ones that are at risk for developing FIP if they get that mutation. There are factors that increase the likelihood of a cat developing it. Kittens, as well as young cats under the age of 2, are generally more susceptible, as well as cats that have FELV, which is the feline leukemia virus, and geriatric cats, although it's rarer, they do have a better susceptibility to it. But generally, the majority of cats that develop it are under the age of 2. Coronavirus is not a highly contagious disease, so for people that have pets just in their household, if they're isolated, they generally won't get it. But it's found more in shelters where things are spread around easily. It's passed through saliva and feces, so if cats are licking each other or if they share a litter box, they will generally pass that disease around, and it can survive in an environment for several weeks. But the most common way that it is transmitted is from a mother cat to her kittens during birth, and then they develop symptoms about 6 weeks after they're born. So now we've talked about who is susceptible and what it is, so let's talk about how it's being treated and researched currently. So FIP is unfortunately always fatal, and most treatments that are used today are geared towards short-term remissions and supportive care. So they have things where they can drain the fluid from their belly and reduce the pain and discomfort of that. They are also able to give them corticosteroids, cytotoxic drugs, antibiotics, and fluid therapy, as well as blood transfusions in order to let the cat live a healthy life for as long as possible. Current research that is being done is generally done at the Wine Feline Foundation, and they're doing lots of research. Some of it is done to find immunosuppressive drugs that slow the progression of the disease, as well as antiviral drugs that either prevent the replication of the virus or slow it down. They have had some success with slowing the virus down with some of these drugs in recent years, but it's still fatal. None of the cats were able to live more than 6 months than what they were supposed to. So with a good portion of households in the U.S. owning cats and a great deal of those cats being rescued at shelters, FIP is a virus that people should be aware of, especially if they are adopting young cats from shelters. We have discussed how this virus is able to use a cat's own immune system to spread, who is most at risk for developing this disease, and what the current treatment and research being done is. In conclusion, despite research currently being done that could be promising, feline infectious peritonitis is still a leading cause of death in kittens and young cats, especially in shelters, because it is still always fatal.